and welcome to the 12th session of the refresher course in palliative care. Today we have the lecture on grief and bereavement by Miss Smriti Rana. I'll introduce her. She's trained in integrative and holistic psychological counseling. She heads the policy, strategic partnerships, and community engagement division at Pallium India. Smriti leads programs ranging from national outreach, national and international advocacy, development and integration of curricula, gender equity, balanced access to essential opioid analgesics, caregiver and patient advocacy, appropriate end of life care, and palliative care in humanitarian settings. She has been a spokesperson at the WHO and Union for International Cancer Control Roundtable on cervical cancer and part of several international experts groups working on access to internationally controlled essential medicines for pain relief. Smriti has led psychosocial training sessions at Pallium India since 2012, and she has also been guest faculty for 3 consecutive years at the Dartmouth University's Global Healthcare Foundation session. So, our co-facilitator for today is Dr. Priyadarshini Kulkarni. She's a palliative medicine consultant at Pune, and she's also the author of Touching Hearts Gently. So we'll have this lecture and the question and answer sessions for grief and bereavement from 7 to 8. And at 8, we'll have case presentation by Dr. Rimi. So over to you, Ms. Smriti Rana, and welcome to our faculties and our refresher course students.
Thank you, Dr. Goraya. Just give me 1 second, please. Yeah, so I just wanted to make a small correction. Sorry, there's a little bit of static coming from somewhere. Yeah.
Dr. Priyadarshini, if you can, is it coming from your side, the static? Yeah.
Okay. Sorry, I just wanted to. Thank you. I just wanted to say that today's session was, I think it was Dr. Priya Kulkarni who actually really put the nuts and bolts of the session together. And rather than co-facilitating for me, it will be the other way around. So I'm going to hand over to Priya to take us through the session today, and I'll come in the course of the session. Thank you, Priya.
Oh, thank you, Smriti. And it's actually both of us working together. So will you be sharing the presentation, Smriti?
Yes, I can do that once.
And make me co-host as well, right?
Yeah. Arun, can you please do that?
Ma'am, your phone.
Is the screen visible?
Yes, yeah. Okay, so so can I take it ahead, or have you made me co-host, Smriti?
Ma'am, you are co-host.
Your co-host Priya, but you can just let me know when you want to move slides. I'll move it from my side.
Oh, okay. Okay, fine. So go next. Good evening to all, and we'll straight go without wasting the time. So in this lecture today, you will understand the basic concepts about loss, grief, and bereavement. Then we can go through what is normal grief and what is pathological grief, and little bit of a emphasis on theoretical frameworks related to grief work, and we'll just touch up on grief management. You know, it's a vast subject and it's difficult to cover everything in this 1 hour, so let's see how far we go. Next, Smriti. So all of us are facing COVID times, and look at these brilliant pictures by Amul. They always come up with something very nice. But last March, When we started off with COVID, it was actually exciting on home front, isn't it? Like we for once thought that all the family members are going to meet each other for longer times during the day. And most of the households, because there was no maids coming in, were really wanting to make everybody in the household happy by trying to think and make new things for food while juggling with their own work and making the most of it. Next. Smriti, is it all right if I can do it as I speak? Is that possible?
Yeah, I'll stop sharing, Priya, and then you can share from your side. Is that okay?
Yeah, we'll do that. Yeah.
Okay, I'll do that.
Is it visible? Is it visible?
Yes, ma'am.
Yeah, okay. So let me just. Sorry for this. So, when we were still getting into this COVID times and getting it into a routine lifestyle, we learned to be Atmanirbhar. You can see from this picture that there is a mobile on one side. This lady is trying to answer the phone while making the food and also trying to work, and then it started becoming little irritable. And then what we are doing still is happening on a daily basis, whole day, for everybody, like COVID conferencing while eating, while having cup of tea. It's ongoing till today, last 1.5 year really. So while we enjoyed these timings initially, we also lost many things during this COVID times. So look at this picture. She's thoroughly bored, isn't it? Look at this child. He doesn't have friends to play with him. He can't go out. Parents are working all the time. He has no school. He can't be sitting in front of a laptop or whatever tab all the time and communicating with his friends or peers. There were many people who lost their jobs, and suddenly one day they were in the job and next day they were not. It changed their life overnight. I know very few close friends had to go through that. In the middle of everything, whatever they had planned, it shattered. And this is still partly happening, like 10 to 4 in Pune, but rest of the time they don't have any work to do. So loss is just not, what we lose at the end, but these are all examples of loss. And the worst part was lonely hospitalization and lonely deaths. Imagine somebody who's working till today in mid 40s, a colleague comes positive, so company tests rest all the people working in that company. Wife comes positive. She was shifted to a COVID care center. 4 days later, her husband comes positive. He shifted to another COVID care center. And from there, both of them in those areas, they are shifted to two different hospitals, needed oxygen support in their 40s, went to ICUs and died 3 days apart from each other without knowing where the other person is. They have two daughters, 11 and 7, and they just didn't see their parents being sick, and they are not going to see their parents anytime again. Can you imagine the agony these girls are going through? There was excellent article in Marathi newspapers last year mentioning about the person who's sitting here and who was involved in taking dead bodies in the ambulances and lighting the pyre for everyone, all the family members. It was so horrific and it was heart wrenching. You know, he was just doing it day in and day out without family being allowed to do that. I'm sure you must all have these kind of stories. Can you imagine a patient sitting in a bed with no relative coming, no food coming from any of the family member? You can just talk, and I can tell you one of my first interaction with this kind of loss is I got a call from my friend from US, and she said, Priya, we need your help. She and her husband, only children of their parents, they were there in US, and her husband's father, who was staying alone in Mumbai, had cough for 2 days, went to GP. From there, straight was taken to a hospital they didn't know. The doctor they didn't know. Father-in-law, my friend's father-in-law didn't have his mobile with him. Some of the family member made some arrangements for admission and let these people know. From there, next 12 days he was struggling, and then he died without having any connection with this family, this immediate ones. You can imagine what this person in his late 80s would have gone through while sitting or lying down in that bed. So, with this introduction, Rajlakshmi, can we have that little quiz? And the idea of this quiz is we would go through these 6 or 7 questions, and you can put the answers to yourself. Nobody is going to judge whether you write all answers right or wrong, but probably you will find these answers during the course of the lecture. I'll stop sharing here, Rajlakshmi.
Ma'am, I don't hear. Ma'am, we will do, ma'am.
Yeah, okay. And at the end, would you like to just state the answers as well?
Ma'am, I
Or
think
or people all people will realize it as we go along. I think that's okay. So should we stop here or what?
ma'am, I think 2 minutes over. We can stop.
Yeah, we can stop here. Yeah. Okay. Thank you. So can we go back to presentation?
Yes, ma'am.
Okay. So, so as I mentioned earlier, loss is just not the end of some person, but it could be end of education. We all remember when we finish our college days or maybe 10th, and we know that we are not going to meet all the friends and have all the fun. It could be end of relationship. As I said in the picture, it could be loss of a job, or it also includes death of a loved one. So if we have to define loss, it is the fact or the process of losing something or someone which is very precious to us. And I want you to remember a death of someone close to you and think about very quickly about these points. Was it natural death or unnatural? Was it sudden death, maybe due to heart attack, or it is due to prolonged illness like cancer? Were you the person who was actively caring? Age of the person who died? Who was, what was your relation to them? How did you get the news? And what was your first reaction? And I think the whole lecture is going to talk around the reactions of listening or getting this news. So, what is grief? Grief is that response. It could be physical, emotional, somatic, cognitive, or spiritual to actual or threatened loss of a person, thing, or a place to which we are emotionally attached. See, we feel bad because we have a connectedness with that person or that thing, or maybe job. We grieve because we are biologically willed to attached. And when we talk about grief, it includes that sense of sorrow, burden, and that heaviness. I think you're following, right? Hopefully. So coming to medical environment, there are series of losses on every person depending on their role. For patient, it could be loss of self-image, their functional status, they're not able to meet their loved ones, they're losing out on their work, they don't know what future lies for them, and it's the time, precious time they are losing on. If you think from a family front, they are losing, like suppose if a daughter is a family member looking at father who's dying, she or he would think that how he was earlier and how he has become now. There is a change of customary family roles, financial stability or instability coming because of illness, and they do have, considering a relationship between the partners, it could be shared past which affects them a lot as well. And also for physicians and other healthcare workers, there is certain relationship building over the period, and there is a loss of that relationship with the death of a person. And we all as human beings respond differently to different losses. It could be like emotional reactions as I mentioned here, or it could be physical reactions like sleeping problems, changes in appetite, physical issues like pain. Somebody just complains of unresolved pain. Whatever you do, pain is not resolved really, or they may have some newly developed illness, physical problems. So, what's mourning? I'm sure we all are familiar with these rituals being performed in a Hindu families. So, mourning is the cultural response to grief. Grief rituals or behaviors which are associated with grief, and they are performed. See, again, coming back to COVID, many of these things couldn't happen. So, when we talk about bereavement, it is the state of having suffered a loss. It is the experience of having lived through that loss. And it's also that state of unhappiness that occurs as a result of that loss. I'm sure we must have lost somebody very close to us in some time in our lifetime, and you would relate to this. So, what are the factors that influence bereavement and loss? The timing of the loss. So, in Corona times, again, people were not expecting their loved ones to die. The occurrence of several losses or a loss with other major life cycle changes. And I would like to say, uh, thing happened in my family. My cousin sister is no more, and her son, only son, was getting married on 19th of June. And his father was a kidney transplant person living for 13 years. They did a day prior, they did all the rituals which we normally perform before marriage, and same night he was breathless and he died around 1 o'clock in the night. You know, it's a different story that that girl who was getting married and coming to this house, her parents really uh, worked on very wisely, and they still continued with the rituals, and that girl did come home same day, on the day her father-in-law passed away. But you can imagine what must be going through this boy's head. He lost his father on the day of his marriage, and what could be the impact of that for all his life. If there is a history of traumatic losses and there is unresolved mourning, the way that death happens all affects how we are going to respond to this kind of a death. So, as I said, there are different reactions, there are different effects, and we have seen some part of it. But emotionally, when persons are in bereavement phase, they really feel empty. Sometimes they are depressed, they are angry, and sometimes they don't know how to respond. There are mixed feelings. They often say that, you know, they can't sleep properly, they have different dreams, and they get up because they have some scary dreams. They don't want to eat, they're restless, they go to the doctor, but doctors can't help them. You know, sometimes socially they go into the shell and they want to be alone, they can't find connectedness with anybody else. And on a spiritual quadrant, it might also affect that they all the time keep questioning that why this has happened to me, why this pain has happened to me only, and why this suffering in my life, and what is the meaning of death of a person who was very close to them. You know, we normally as clinicians don't get involved into all these areas which are very important, but I think we need to begin somewhere. And as we learn to live with in corona times and living with new normal, like if you look at this picture, this girl who's in saloon, and you can look at this man who's wearing the shield and doing hair treatment, or the people who are buying their stuff from places, they are perfectly following the discipline, which is not normal before corona times, but it is normal now. I think we all need to learn to live with our grief after our bereavement time. I think I leave it to, I wait here and let Smriti continue. Smriti?
Priya, I'll share from my side just to
Sure.
maintain the pace. Sure.
Yeah, I'll stop sharing. Yeah.
Okay. Thank you. Thanks, Priya, for that setting the context for us. And I'll also be taking all of you through the next section. So, just to sort of take you through what are the traditional understandings of grief and what is considered normal grief and what is considered pathological or grief that actually requires more professional interventions. So, Normal grief is something that all of us experience. I can see from the answers that all of you have given in the polls that you understand that this is, it is a natural response to a loss. And grief, as we know it, begins soon after the loss, and the associated distress that accompanies grief over a period of time becomes manageable. It doesn't necessarily go away. There may be periods of intense sadness, oftentimes triggered by, anniversaries, by even things like, the smell of a person or a scent that you come across. It could be, childhood memories or some food that you've eaten. So it could be various things that also trigger intense periods of grief in the course of life. But for most part, it is manageable. It doesn't affect your functionality and your ability to engage with those around you. And the thoughts and feelings and the behaviors that accompany grief also help to maintain a bond with the deceased. So when somebody passes away, the person may be gone, but the relationship still exists, even though the person is not there. So if somebody's mother has passed away, it doesn't mean that the relationship is over. There is a relationship that goes on in our hearts and our minds, and the behaviors, thoughts, and feelings that we have maintain that bond with that person. And how does grief manifest? Now, we think of grief as an emotion, we think of it as a feeling of sadness, but grief really has a physical manifestation. And if I were to take a minute to just quickly ask you, you could put your responses in the chat box. Where do you feel sadness? When you feel sad, where do you physically feel it? And the hints there are, the English language is actually replete with metaphors and idioms about it. And many people might feel it. I'm looking in the chat box. Chest, yes, chest, heart, headache, yes, something gripping you in the head. Fatigue, yes, Kiruba. So, and emptiness, yes, emptiness can be felt physically, can it not? Backache. So I can see from the responses, heaviness, which is also a physical experience. Yes. So nobody here is disagreeing that there's no physical component to pain. It is, of course, an emotion. It has an emotional component. We feel sad. We feel all kinds of feelings, including anger at times. Sometimes it might come out if there's something unresolved. There might be feelings of abandonment. There might be all kinds of emotional feelings attached. Grief also affects us cognitively. And cognitively, in terms of it might affect our ability to concentrate on tasks for a while. It might impact our problem-solving abilities. It might affect our attention span. It might affect, even how we're able to process information. All sorts of cognitive dissonance might come in. There might be, all kinds of other cognitive issues that emerge as a result of the grief experience. It is certainly a spiritual experience, as Priya has already mentioned. And spirituality here, I just want to mention very explicitly that it includes, but is not limited to religion and religious beliefs. So people experience spirituality in many ways, but the main components of spirituality are also a sense of meaning. What gives you a sense of meaning? What brings you comfort? What brings you hope? What connects you to people and things around you? So for some of you, it could be things like art. Some of you, it could be music. It could be a walk outside, being in nature. It could be just being in the presence of children. And for many of us, it could be our relationship with a higher power, whatever it might be for different people. And grief certainly impacts that. It impacts our sense of hope. It impacts our sense of meaning. It affects our sense of comfort and connection. And finally, grief is a social experience also, because grief, no matter who we are, it is not experienced in a vacuum. And while grief is an individual feeling, it is something that requires some sense of connection with those around us to help us through it as well. And socially, when people experience deep, intense grief, they might withdraw socially. They may not want to meet other people. And so it does have a social domain also to it. So as you can see from this picture, it is a It's a multi-dimensional experience. It is not just an emotion. So as doctors, as healthcare workers, we must consider that when somebody is grieving, that all of these different aspects of them might be getting affected. So it's important that we remain sensitive, that something manifesting as a physical complaint could very well be rooted in grief. And somebody is having difficulty at work, it could very well be because they're grieving. So it may not be that their cognitive ability is diminished. It's just that in that moment, they're overwhelmed by what has happened to them or to a loved one. There are several factors that influence grief, and I'm not going to go into the details, but I'm just going to signpost you to some of this. Attachment styles is something that as psychologists we study, how we attach ourselves to important people in our lives as children quite often affects how our grief is manifested as we grow older. If our attachment styles are unhealthy, it might result in unhealthy coping patterns when the person passes away. If our attachment styles are healthy and we have a relationship where we understand that a person cannot always be present, that there are moments of separation, etc., then our coping styles are also impacted by those things. So Mary Ainsworth studies are something that if you're interested in researching this a little bit more, that's a place you could also look at. The way the family is structured impacts our grief experience. And in families, there are different aspects to how people align with one another. There are subgroups. There is the parental unit. There is the parent-child unit. There are the sibling units. And how these talk to one another and how they interact with one another also impacts the grief experience. What are the boundaries? Are there emotional boundaries in the family? Or are you just, are they very enmeshed? Are people in each other's emotional, are they very sort of entwined in each other's emotional lives? Is there a sense of flexibility, of giving space to one another within the family to have their individual experiences? There's also the dynamics. So structure and dynamics might be two different things. And who talks to whom? How does that communication take place? Are you able to express yourself freely within the family or in your circle of loved ones? Are you received? Are you listened to? Is there empathy in the family? Or are you supposed to just, suck it up and be stoic and get on with it, as that was what is expected of you? So all of these factors also impact our grief experience. And of course, it might seem obvious to say this, but social support is very, very important. And families who are cohesive, who have healthy engagement with their communities and their social institutions and other social bodies, usually also feel quite supported. You might be part of a church group that really comes through for you at a time of deep grief. You might be part of a satsang. You might be part of a parent association where people are very close to one another. You might be part of a football club where you have friends and who you rely on. But families that are isolated tend not to mingle too much, also then have to deal with grief in their own ways. If there is dysfunction within the family, intra or inter, prior to a crisis, it is quite likely that the coping mechanism also becomes dysfunctional. If there is more cohesion in the family, if it is a cohesive unit, chances are that they might have more resilient ways of dealing with a loss and with its subsequent grief. There are three aspects to grief. There is the experience, how you experience the grief, what goes on in your inner world, how you express it. How is that grief manifested? How is it communicated? How is it displayed? How is it demonstrated? And how overall one adapts to the loss. So these are the three ways in which. Now, how you experience grief and how you express it is not always the same. That's where societal sort of expectations, all of those filters come in. And that very much impacts how you adapt to the loss. Historically, there was a lot of gender stereotyping about how grief is to be expressed, right? Men don't cry. Women are more emotional. Men are expected to be more stoic. Those are traditional gender stereotypes. Over a period of time, people who studied grief and who researched it and talked about it said that, okay, masculine and feminine. But even then, that had some sort of a label attached to it. So if someone had more masculine ways of expressing grief, and if it was a woman, then again there was a bit of a stigma attached to that. So finally, people started, the experts started saying that let's talk about it in terms of intuitive and instrumental. So there is gender neutrality.
Smriti ma'am?
It's inhibited when it comes to sharing inner experiences.
Smriti ma'am?
Yeah.
Sorry to interrupt you. Actually, we lost you for some time. For a few
Oh,
minutes.
sorry. Can you hear me now?
Yes, ma'am.
Okay, so I'm just gonna, I don't know where you heard me last. Okay,
I think
so
we lost you when you were talking. You were just starting about instrumental head.
It was more gender neutrality was being.
Okay,
Yes.
gender neutrality. Okay, fine. So, basically, people who are able to express their emotions comfortably, are able to share their inner experiences, reach out, talk about what is bothering them, etc., are on the intuitive spectrum. And those who are more comfortable, taking all that energy and then, putting it into problem solving, more cognitive and intellectual exercises, and prefer to discuss problems rather than feelings with the view to solve the problems. Those are people who are considered to be more on the instrumental spectrum. That's not to say that you are either or. All of us have both traits. It's just one that might be more dominant at a time of crisis or in a time of loss and mourning and grief. And then there is the center of the Venn diagram, like I just said, blended heart and head. But then there is dissonance. What if you are somebody who's very comfortable talking about your feelings, but your community or your society does not deem it fit for you to be able to do that? And this is again where gender stereotype comes in. And what you are feeling in your heart and how you're supposed to express it, there might be some conflict with that, and that actually leads to more distress because you're expected to behave in a certain way. If a woman does not show emotion when she has suffered a grievous loss, she's considered to be cold, but actually she could be just very well be an instrumentally oriented person. Just going into some of the different facets of grief. Grief is not only something that is experienced after a loss. So those of us who are working in palliative care, which is I think everybody in this room, will encounter this many times. It is grief that is felt in anticipation of a future harmful occurrence, what you think is going to be harmful to you. The death of a loved one is a classic example. If you know that somebody's prognosis is not good, you don't have to wait till after they die for you to start grieving. The grief already settles in. And it is also compounded by a series of losses. So grief over losing mobility, grief over becoming more and more dependent on other people, grief over losing your sense of autonomy and your freedom. All of these things to grief. And sometimes people label it as depression. This person is depressed. So I think if we have time, Priya is going to be touching upon the difference between depression and grief. But let's also be open to the fact that what your patients and their caregivers might be experiencing is anticipatory grief. And it is also experienced by professionals, by healthcare workers. And that's something for us to recognize also. And I think there's been a lot of grief that we as a healthcare cohort have experienced over the last year and a half now. I'm going to touch upon the stages. I think most of you will be familiar with Elizabeth Kubler-Ross's stages of grief, so I'm not going to spend a lot of time on it. But I think the one point I would like to make here is that these 5 stages perhaps need to be reframed in a sense because they don't occur in a sequential pattern. And neither is it necessary that somebody has to go through all 5. So that is something for us to remember. And it is not necessary that everybody, if somebody has not gone through a particular stage, that it's abnormal. So You can even make it all the way to acceptance, and then one fine day wake up angry. So that's just something for us to remember. I think where we're coming at this more from is that these are some of the major emotions people feel at a time of grief. And when we go through these different stages, in whichever sequence, in whichever order, and whether or not we go through them at all, these are some of the ways in which they can manifest. Denial and shock is something that we see a lot. People just don't want to believe that it has happened. There's confusion. The reality has not set in. There's numbness. People start blaming one another. Anger also manifests in various ways, as do depression, detachment. There's bargaining. Wanting to tell your story, struggle to find meaning of what has happened. And in the case of anticipatory grief, bargaining with God. If you let me live till my daughter gets married, then I will do this. So that kind of bargaining also takes place. And acceptance is a form of adaptation. But like I said, you can slip right back into any one of those other phases also. That is not out of the ordinary. Warden was somebody who studied grief, and he approached it from the point of view of tasks that needed to be achieved. Grief also has tasks. Now, what are the tasks that you have to go through? It's almost like, what as a child comes through developmental stages, there are certain tasks he or she needs to master. So similarly, as you go through the grief process, there are different tasks that you need to go through. First is, according to Warden's theory, accept the reality of the loss, that yes, it has happened. It might take some people some time to get to that point. Once you have accepted that it has happened, you have to work through the pain of it. There's no getting around it. And the only way to work through it is to experience it. If you need help through it, it's important to get it. But there is that very painful process of going through it. Adapting and adjusting to the environment in which the disease no longer exists, which is very difficult, especially if two people were very attached, they were heavily dependent on each other for various roles, and people who've lived a lifetime together. I mean, you see various aspects of this. It's very, very difficult to adapt and emotionally relocate the deceased and move on onwards. Now, what does it mean to emotionally relocate? It means that to accept that they've gone, but that doesn't mean that our feelings towards them has gone away. So what do we do with those feelings? We need to find ways to sublimate them. And perhaps, different people do this differently. So these are Warden's tasks, according to him. There are two other researchers, and I'm not even going to try and pronounce those names because I don't want to get it wrong. And what they see it as is grief as a two-dimensional process. There is the loss orientation, where you've had the loss, and now you have to deal with the distress, a lot like what Warden said. But then there is a restoration orientation. Once you have to shift the focus from the actual loss towards going onwards in life. And oscillating between the two also happens. So it's completely natural and normal for somebody to shift their focus. Sometimes they might get fixated on the loss again. Sometimes they might go back to the guilt, the pain of it. And then sometimes, okay, now I need to think about what I need to do next. How am I supposed to move on? Do I need to move house? Do I need to go somewhere else? Do I need to change? Do I need to change my bank account? My bank accounts, it was a joint account. I need to pay attention to practical tasks, those kinds of things as well. This is just a summary of the previous three things. We'll share these slides with you, so I won't go into that. And we hear this a lot, complicated grief. Complicated grief is pathological grief. So all this while I've talked about the normal process of grief, some general theoretical frameworks, but now we go into the territory of when we need help with our grief. So complicated grief is intense and long lasting. It really impacts the functionality of the person. It overwhelms them and it prevents them from actually doing the work that is restoration oriented. Okay. And it is completely, the natural healing process is completely derailed. Now, there could be several reasons for this. And one could be the nature of the relationship with the deceased person. Attachment styles could come in here. It could be a relationship that was completely enmeshed. It could also very well be a relationship that was conflicted. It could be a relationship that was abusive. It could be a relationship that did not see closure. So it could be that the two people had been estranged for many years, and one of them hoped for reconciliation, and that didn't happen. So it could be all of those things. Circumstances of the death. How did the death take place? Was it expected? Was it not expected? Was it traumatic in the sense that it could very well be that the person committed suicide? It could be a drug overdose. It could be, it could be a myriad number of things. And COVID is a prime example of that. The circumstances of the death, somebody gets sick, they get rushed to a hospital, you hope they'll get better and come back, but no, they get sicker and sicker, and then they die, and you did not even have a chance to meet them. And that is a classic example now of what we're facing, because COVID in its wake is going to bring a lot of complicated grief. It's already here amongst us. And events that occurred after the death, trauma that happened because the person died, somebody being completely, maybe the person who died was the one who was keeping them safe. Maybe there was massive conflict and dispute within the family. The family fell apart after this person died. Maybe that was the person in the family who was keeping the peace and who was maintaining certain roles, maintaining certain boundaries. So events that happen after the death also complicate grief. And this is something for us to remember, and we need to be prepared for this in the COVID crisis that we are facing. And finally, in terms of disenfranchised grief, in terms of pathological grief, I want to just touch upon disenfranchised grief. It is when the grief that is considered unacceptable by others. When does that happen? That happens when the relationship is not recognized by others because they did not know you had a relationship. It could be a secret relationship. It could be a relationship that your immediate family or their immediate family did not know about. The relationship was real, but the family or society does not approve of it because of cultural considerations. It could be a non-traditional relationship, like a same-sex relationship, that is not accepted still in a lot of communities. And so even if two people have lived as partners and as companions all their lives, because society does not respect or give it a place, when one of them dies, the other person's grief is not considered legitimate. And finally, the way the person died is not supported, like a drug overdose or a suicide, which is a similar example I gave. Or if you think about it, one of the examples from maybe, suppose there's been a mass shooting and there's a person responsible for it, and that person is killed. The parents or the family of that person are in shock. They didn't expect that to happen, but also they have their own grief about that person's death. But that person is not considered someone worth grieving by a lot of people. So there are all those complications as well. Prisoners, things like that. So disenfranchised grief is a very real thing. It's one of the most poignantly painful things, I think, that exist. And it is also experienced when the loss is not a person, pets, a failed marriage, unfulfilled dream, a project, and loss of your functioning. So that we go through all. Healthcare workers are also particularly vulnerable to disenfranchised grief because we as healthcare workers are not supposed to mourn the loss of a patient, and that's part of our job. But then how many of us are above that? Okay, so I'm going to try and just quickly go through this with you, keeping in mind the time. When you talk to family members experiencing grief, please remember that uncertainty leads to anxiety, which leads to imagining the worst. So please try and give them as much information as possible, clearly, compassionately, empathetically, because any gaps in their imagination will be filled by the worst, or even worse yet, Google. Use available technology to stay in touch with families. especially now in COVID times. Please avoid jargon. Use language that is simple, that is understandable by them. Please talk to more than one family member. And that's important because when somebody is deeply grieving, they may not process information correctly, and they might lead to misunderstanding so try and talk to more than one person so that the message is clear. If you have achieved good symptom control, and especially so in COVID times when the family is away, as much as you share the progress, also mention the good things that have happened, because that really helps the family. Please don't take emotional responses this is very difficult, I know, at a time when the healthcare system is pretty much under assault. It's very difficult not to take this personally, but well, that's something that we try not to do. Be prepared for guilt. Families do feel guilty. I didn't do enough. I should have done this earlier. I should have gotten to the hospital earlier. I should have gotten this test earlier. It's very important that you help as a healthcare worker assuage that guilt, because really coming from you really means a lot to the family, as opposed to also coming from lay people and relatives and friends. When it comes from an expert, when you say you did your best, we did our best, it really helps with the grief. And ask the family to describe the patient as a person to you. This is a great way to build rapport with the family and also to build empathy. Rather, then they know that you're not treating that person as a case. Tell me something about your father or your sister or whoever the patient is. Tell me what you'd like me to know about them. What do they like? Okay, so things like that. And while you're dealing with a grieving person, please remember that your behavior is more important than your words. We don't always have the words to convey our condolence or our support, but our body language and our presence can make a big difference. Please be aware of your own feelings. Not all of us, no matter how long we've been in the caring professions, we may still be carrying our own grief. And sometimes that gets projected onto other people, or we get triggered by other people. So always good to reflect on where you are with your own grief, if you have also gone through some sort of loss or bereavement. Listening is the most important skill. Please don't overprotect people. It is their loss, it is their story, they need to go through it. And help people find their own solutions. Don't give them solutions of your own. And especially if you're talking to colleagues and other friends, at an appropriate moment, share a happy or a moving experience. People sometimes say, I don't want to take the name of the deceased person because it will distress this person. Just because someone dies doesn't mean that the person is forgotten. And it's very difficult for me to process my grief if you come to visit me and you don't even want to take the name of the person who I have lost. So that's where we're coming from. And please don't tell them what they should or shouldn't be feeling. Please don't compare their experiences to others. But look at that family, what all they've lost. That's comparison is terrible. It's a terrible thing to do. Be clear about what you can offer. You may not be able to do everything, right? Be clear about what you can offer. Very often we tell grieving people, I'm here for you, call me if you need me. You're giving a grieving person one more task to do. Instead of that, it would be good if you said, would you like me to take your children, across to your grandparents' place? Can I bring you some food? Practical tasks. So that's on a layperson level. From a healthcare perspective, please, you know what your boundaries are, what you can offer only that. And if you do offer it, please follow up on it. Cultural differences, of course, exist everywhere. And learn to recognize the grieving difficulties, complicated grief, disenfranchised grief, anticipatory grief, and help them work. I will stop with that, Priya, and let you share your screen. Priya, you're mute. Still muted, Priya.
We can't
There
hear you.
you.
It's okay?
Yeah.
Okay.
Yeah.
So
Sorry to
I'll
interrupt you, ma'am. We have only
yes.
5 minutes left.
Yes, I'm
Yeah.
aware of that. So I'm running with super speed. So just to let you know that if children are old enough to love, they are old enough to grieve. Many a times in our society, children are the forgotten grievers. For instance, when a parent dies, whom do we expect to help the child with their grief? The surviving parent. That parent not only has their own grief to deal with, but they are learning for the first time how to be a single parent. They, like their child, can use support in their grieving. It's important concept to understand while we are dealing with that, and why we are talking about this grief manifestations and what happens if it is unresolved, because it leads to certain behavioral problems. Persons may just stuck up and they can't move forward in life, and that's
Priya,
detrimental. Sorry.
Priya, we can't. If you're sharing slides, we can't see it yet.
Oh, is it? Oh, sorry. Is it now?
Yes, yes, we can see it now.
Okay.
You can, yeah, go into
Yeah.
full. Yeah, perfect.
Yeah. Okay. So, how we have to talk to these people, considering that they may go into major depressive disorders, and it is stated that about 20% of bereaved people might develop major depression. There are certain risk factors, like if they have history of depression or alcohol abuse, or if there is an inadequate support system. So I think we have just done the repeat. I will not go again. Just to know that we can assess grief with series of different questionnaires. You can Google through this. This is just a sample. I think you will get this. Again, as Smriti said, grief counseling goals are increase the reality of loss. We have to help the bereaved person to deal with both experience and latent affect. We have to help them to overcome impediments to readjust, and it has to be a healthy emotional withdrawal. Our effort should be directed towards that. I think I'll just touch upon these two things. There are certain myths about grieving, but I'll just focus on reality, that it's always perceived that we only grieve deaths. It's not real. Only family members grieve. No, it's not true. Those who are attached will grieve. Grief can be manifested in different ways. We cannot control how one grieves, and it's an uneven process. It's a roller coaster ride, so there is no set rule. One person goes from one stage to other stage. We can never fully detach from somebody whom we are attached once upon a time, and therefore rather than saying you have to forget whatever happened in the past and move on, we can move on with the memory of the times we spend with the person who has passed away or died. So we also have to remember that grievers need opportunities to share their memories and grief and to receive support. So we have to create that environment for that. I think Smriti, you would like to conclude. Hello.
Thank you, Priya. And like Priya had mentioned in the beginning, that grief is a really vast topic. And what I hope we've managed to do today is to introduce you to some of the finer nuances of it, and also to perhaps going forward, be mindful of the fact that somebody might be grieving in your circle, and how they may be best supported. There's a lot of literature, there's a lot of wonderful work out there about grief and bereavement. So please do take the time to explore it, mind space for it. I know it might come across as a topic that's quite difficult, but it's one of the most human experiences, and all of us need to be intimately acquainted with it, not just from the point of experiencing it, but also the point of being able to support others. I will just stop with that, and I think it's time for the case to be present.
Yeah, thank you. Thanks a lot.
Thank you so much. That was a great session. We'll have question and answers after we have our case presentation. So over to you, Dr. Jimmy.
Hello, am I audible?
Yes,
Yeah,
yes.
you are.
Okay, so I wanted to know whether I need to on my video or is audio good enough?
Uh, Ma'am, if your network is good, means you can turn on your video. Hello, Jury, ma'am.
Everyone. So my case presentation today is regarding grief and bereavement. Can you take to the next slide? Yeah. So this patient is a member of my extended family. She is my cousin brother's wife. So this is something very close to my heart, and I wanted to share this. This about her. So she's a 43-year-old female, and what after being with her and going through what all she is experiencing, this is my diagnosis. I could be wrong, and I would if correct me if I am, but the patient is undergoing chronic grief and bereavement. So can I have the next yeah. So um patient feels the presenting complaints. Patient feels shocked with inability to accept the unexpected death of both the parents. And they died due to COVID-19, and she is unable to accept their death even after 2 months. Now, she has difficulty in falling asleep. She has disturbed dreams and often wakes up with a feeling that something bad is about to happen. Patient is fatigued. She reports many instances of forgetfulness throughout the day. Patient has lost weight and reports loss of appetite. I think regarding what all Smriti ma'am and Priyadarshini ma'am told us, I'm sure you are able to find, catch hold of these symptoms and understand why she is going through all this. And we can discuss this in the end as well. So back to the story. Patient has lost weight and reports loss of appetite. She feels unhappy and anxious most of the day. So, what her husband told me was, something which I would like to share. He said that a person's thoughts, feelings, emotions, and mind are a very strong tool and can make paradise or hell on this earth for the person, which was very true after he found a very different spouse than what she used to be. So patient has started to remain aloof to her spouse and all the members of her immediate family. She displays long spells of unusual silence that is unlike her nature, according to family. She has cut off from friends and family and does not respond to them on mobile. So, both the parents' history of illness, both the parents died unexpectedly after recovering from COVID. Both of them had come back home after testing negative. Then first the father and expired unexpectedly due to sudden fall in oxygen levels. So this was very common, which I found in many of the deceased stories, that suddenly 1 hour ago the patient is fine and suddenly the oxygen falls, and and the patient is unable to be, to recover, and he could not be saved even after oxygen cylinder treatment was given. The patient left. Now this lady, the patient, she had left 1 day before. So she thought that now they have come back from COVID and all is well, so she went to her husband's house. So that same that the next day itself, suddenly, when all of a sudden her father was eating well, had a good day, and then suddenly the oxygen started falling and he was gone. So she feels guilty for not reaching on time and not being around to help and view the last moments. Now, the mother expired after 5 days. Her death was also sudden and unexpected. So, here, this patient has lost both the parents 5 days of each other. So, this was, all very sudden and very unexpected. Now, patient had met the mother 1 day before and was thinking of visiting her later in the day, that is on the day she died. And again, the patient was not around when the mother died. So first, when the father died, she was not around, and it was very, very unexpected and a shock for her whole family, as he was recovering well. And then 5 days later, the mother also unexpectedly, just she died. So the patient has constant yearning and cannot come to terms with the fact they are gone even after 2 months. Patient refuses to acknowledge or talk about her loss. Patient has lost interest in all her usual activities that she used to do in her daily routine. She remains silent and prefers to be left alone. This is unlike her usual nature. It seems as if she is stuck. Lack of sleep and of loss of appetite has disturbing dreams and remains anxious most of the day. On examination, yeah, she's the youngest in the family and very attached, and was very attached to both the parents. As Smriti ma'am said, that we continue to form, we continue to take the relationship forward in our heart and mind, even after the parents have, even after the parents are gone. So she's still, it is very hard for her to be in this, to understand that they are no longer there. So, and there's also a lack of social support as siblings stay far apart and patient stays alone in a nuclear family with no one around to interact, as husband has 12 hours shift. She appears numb and does not want to talk about death when prodded by anyone. Treatment and significant investigation. The patient is counseled to agree, and to see a clinical psychologist that can help her go through the process of acceptance stage. Blocking out her emotions are creating havoc on her physically and mentally. She is strongly urged for physiotherapy sessions that can help her go through the process of grief. Her husband is very worried with her behavior and does not know how to help. He is counseled about how grieving takes time for some, and to give her time, space, and some good time patiently. So the psychosocial aspects, patient is in chronic grief and bereavement after 2 months. Grief has affected her physically, emotionally, and spiritually. Uh, Patient likes to remain aloof and does not interact. Patient has stopped praying. She used to pray, a lot, and now she has stopped praying. Her immediate surroundings no longer hold interest, including cooking, which she used to enjoy. Patient cannot Patient cannot sleep and remains anxious uh, throughout the day. The thought of meeting with with people elevates her anxiety. Patient also appears to forget things and goes into a prolonged state of loneliness. Patient has only few friends and they are also not in her city. So, the plan. As advised by the clinical psychologist, the patient needs to undergo both session therapies as well as anti anxiety medications to help her relax and sleep well. Family members are also counseled to keep in touch with her and help her go through the various stages of grief by being there for her and giving her company as much as possible. Relaxation exercises and small outings with friends and family. Patient is encouraged to indulge in social activities as patient was religious and is now lost spiritually. She is also encouraged to seek spiritual support in whichever way she loves connecting. So the main concern is to first correct the correctable. Focus is on improving her physical, mental, emotional, and social well being. The prolonged grief, along with guilt, is worsening her situation. Um, the patient should be handled by a clinical psychologist that can take her towards acceptance stage and lead her to a meaningful life with a new plan. So as ma'am had explained, there are various stages, and as the patient is stuck, it is a bit complicated. It appears to be complicated grief that is creating harm for her, that is unhealthy for her. So she needs to start going through the process, and a clinical psychologist help is a must that can help her uh, you know uh, come out, get herself unstuck from her situation where the life has come to a complete standstill for her. So the clinical psychologist can help her move from that stage and to the acceptance stage and help her lead a meaningful life with a new plan that is without her dead parents. So, as ma'am Smriti ma'am explained us that we continue to form bonds and we have to live in that same environment, minus the deceased relationship. So, the clinical psychologist can help her get a new meaningful life and can help chalk out a new plan for her, especially as ma'am said that things that need her attention can help her go through the process. Like she gave the example of a joint bank account that needs to be taken care of, or whatever will, according to the will of the deceased, whatever things that need to be done. So starting from there, small plans can be made that can push her towards something meaningful and something divert her attention and can heal her. So, yeah, she has to accept that her loss is real, experience the pain, accept and adjust to the normal functioning of life. Husband and immediate family is counseled to help her in the process. So, as ma'am told us in the communication tip, how the immediate family and the husband, they need to be counseled, and how important it is for them to understand, and along with the sessions and the help of a medical professional, or with the help of a clinical psychologist. Apart from that, someone that is constantly in her inner circle, because we as a medical professional should know our boundaries and limits, that we can only touch upon the patient when to a point. Someone who's staying with her all the time, they need to be counseled as well, so that can help her heal. The next slide. Yeah, so this is a summary. The patient is a 43-year-old female and suffering from chronic grief and bereavement. Patient appears to be in shock with inability to accept the unexpected death of both the parents due to COVID-19. She has difficulty in sleeping and has disturbed dreams. She often wakes up anxious with a bad feeling as if something bad is about to happen. Now, that is creating a lot of problem for her. Patient remains aloof to her spouse and immediate family and behaves unusually silent most of the time. So she's unreactive, unresponsive, and anxious all the time. She feels unhappy all the time as well. There are many instances of forgetfulness that she experiences throughout the day, as Smriti ma'am told us how cognitive function is affected with grief. So there it is. There is that. I think that is a typical case of cognitive grief, because she is having this forgetfulness. Patient has lost weight and does not eat well, claiming loss of appetite. So that is again a physical grief symptom. Patient has lost interest in all her previous usual activities. So basically, life has just is just standing still for her. She prefers to be left alone to herself and does not want to acknowledge or talk about her loss with anyone. She does not respond on mobile to her immediate family and friends, and she feels guilty for not being present when both of her parents expired. She is youngest in the family and was very attached to both the parents. She appears to lack in social support as her siblings stay far away and her friends are not in her city. So she is yeah, so yeah, thank you. Next slide. So the discussion points. So as we know, she is this is an unhealthy grief and bereavement, where she is not responding in a normal way, where she's still stuck, where she's behaving very unusually. That is unlike her nature since the past 2 months. So there are some discussion points here. The patient is lost and broken and stuck in a pattern. What are the efforts that need to be taken to heal her? Number one, physical grief and bereavement. The next is mental grief and bereavement. So, what are the points that these are all things that are affecting her that we saw in her story. So the physical grief that included loss of appetite, difficulty in sleeping, fatigue. So that can be the physical grief. The mental expressions of grief and bereavement, that she has the feeling of anxiety, of yearning for her parents, and the numbness, the aloofment, the social grief, that feeling she's not speaking, she's isolated herself, even from her spouse or from all her contacts, and she is behaving in a way that she is not actually in in her daily routine or in her life. She was not like this, and she is suddenly behaving in a very weird, she is exhibiting a weird behavior and something that is self harming. So that and then of course spiritual expression of grief, that is she that is also that she was a very religious person, and now she's stopped praying and she's just stopped speaking and she's stopped reaching out. So what are the efforts that need to be taken to heal her that way, and how long do you think it will take her to come out of her grief and bereavement? As we know, as ma'am told us, that it can take a long time. There's no specific time period. It can be anything from 6 months to 4 years or 5 years, or it depends on individuals. So uh, the family, along with the patient, along with the clinical psychologist, can better answer this, I think. How to motivate the patient for a productive and meaningful life. So now the deceased is gone, and now we need to build a plan, build a new life for her. So how can we encourage her, or what are the other plan of actions that can be done? Thank you.
Thank you, Dr. Rimi. Though you already have answered a lot of questions which you raised in your discussion point, can we have inputs from our faculty? We have like 10 minutes left for our session to end. Dr. Priyadarshini, Dr. Anne, Miss
So,
Smriti.
first of all, I would like to congratulate for presenting this personal experience. And as it came right after the lecture, I think all of you would have seen the similarity between the theory, what we all told, and what she already faced with her cousin or a relative. So thank you for sharing that. I think coming to the case discussion, this person definitely needs help at different levels. I think we need to really differentiate whether she is depressed already and whether she needs some treatment, even if her anxiety needs to be treated, because it's more than 2 months, as I got from the case discussion. I think Seema is here, and Seema, would you like to add on that how should we differentiate between depression and complicated grief, Seema?
Dr. Seema, are you there? Dr. Seema just put in the chat box. She said we should rule out depression for this
Yeah.
case.
Yeah, I think also the same. And I think maybe all of us coming from different streams, even if we just identify that this person may have a clinical depression, I think the next step is to call for help from a colleague who's expert in this and who can treat this. Smriti, would you like to add something? And Anne, if you can comment. Yeah.
Sure. Thank you, Dr. Rini. This was a it was a very heart-rending case in many ways. Sorry, because first of all, this is someone very known to you, and it's clear that the distress is very, very severe. 2 months, well, losing both parents unexpectedly, thinking one of them is getting better, feeling hopeful, then having that snatched away. So there's a lot of stuff happening. Yes, I would agree with Priya and Dr. Seema also that depression needs to be screened for and ruled out, which could be difficult in this case because of the complicated grief angle. I would also try and understand if there's some sort of PTSD happening, because there is some of the symptoms that she's showing is also of trauma. You said that she's the youngest. She was very attached. She was there. She left a day early. So the guilt definitely has to be addressed. And also, you have clearly said that she is manifesting anxiety. Now, there are ways to also address things piecemeal. The anxiety, the anxiety has to also be addressed. What gives her a sense of safety? It seems like her sense of safety feels threatened. She's just lost both her parents. She does not seem very vocal or verbal. I also wonder about, wanting to fix it, wanting to help her move on. For somebody who's just lost both parents, trying to bring them to a place of acceptance, eventually, yes. But I wonder if we also need to give her the time to grieve the loss of not just one, but two very, very important people in her life. And certainly assess for the pathological elements. But someone had asked, what is the duration? When does it become pathological? I don't think it's defined more by duration rather than the quality of the experience that they're having. The fact that she's disengaged, no interest in any pleasurable activities, no socializing, these long periods of silence, and just the lack of functioning normally indicates pathology, definitely. I would also psychoeducate the family a little bit, because to minimize the anxiety or to minimize the intensity of the feeling may actually be detrimental at this point. Rather, to validate it, to hold that space for her and allow her to feel those things, providing a sense of safety for her would be very important. Someone mentioned, has she been assessed for suicidal ideation? Yes, that's an important thing at this point. If somebody can assess suicide risk, that would be a valuable thing to do. So I'll stop with that. If anybody else would like to add anything?
Do we have Anne in the group? Would she like to?
We
Yeah.
have Dr. Anne here. Dr. Anne?
I thank you. Thank you for thinking that I might have something more to share after this brilliant presentation. And I think I have one experience from the US, which I think will be very helpful because I now work at a hospital that caters to people who have been in combat, veterans of wars. And that has illustrated to me the profound post-traumatic stress disorder, which happens after the death of somebody in an ICU or this kind of trauma. So trauma-informed care is something that I am learning about. I am not surprised by the actions of this grieving person. And I think all the suggestions that have been outlined are good. But I also think moving her to recover too quickly is ill-advised. She's probably doing the work that she needs to do. Maybe she needs pharmacologic or cognitive behavioral therapy. But this is an extremely traumatic event, and well-meaning people trying to move her too fast could ultimately backfire, as she may not feel completely understood. What a fabulous case, and I certainly appreciate your sharing this about your family. I can't imagine what your family is going through.
Thank you.
Thank you, Dr. Anne. So we had a lot of comments in the chat box, but as we are nearing, like we have only 2 minutes left, maybe we can have, if our faculties would like to say anything else.
Thank you for all the suggestions. I will take it all to my cousin brother, and all the feedbacks and everything that you have told us, ma'am. Thanks a lot.
Yeah, thank you. I just would like to make a comment saying that the intent of having this discussion is to start beginning to think about our patients and families in this area as well. Generally, what happens is when we lose our patients, our connectedness with family is not routinely followed. So maybe we need to have a system in place which can tell us that we can at least give a phone call after a month and see how they are managing without the person. If that becomes a routine practice, or while they are under treatment with us, if we can find that they do have some components which tells us that they are going to find it difficult after the loss of the patient, we have to be extra careful and vigilant for them after the death of the patient. I think it's bringing that component into our practice is very important. And then of course, wherever we think that it's not possible for us to manage these issues, getting a help from a psychiatric colleague or a counselor, or offering to connect them, patients family members, to this right people is also important. I think I will stop here. Thank you.
Thank you,
Thank you.
Priya. Thank you so much. And thank you, Gauraya and everyone here today. I echo what Priya said, of course, that we need to remain vigilant to the emotional distress of our patients and their families as well, if we are interested in their overall well-being. So thank you all for your time today. And thank you, Arun, and everybody